You are watching the DocTalk show.
So a lot can go wrong when someone has epilepsy and they get an attack. It may be the convulsive type when they suddenly start shaking the bodies, they lose consciousness and collapse. Or it may be the type which commonly occurs in children where they kind of go into a blank stare and they maintain their positions, they don't fall down, but they temporarily lose consciousness. So I want to understand how exactly what we should do when someone gets an attack of epilepsy and what we can do to help them at home when they're not in the state of the disease attack. So perhaps I can start with you, Dr. Idro. For someone who gets an attack of epilepsy, what should the attendant or the caretaker do? For example, they're falling down, they're shaking a lot. What exactly should they do? Because it can be a very scary state to watch.
Certainly, Darius. Now, a lot of what we have said will appear so negative, so scary. But I would like as viewers to take it that epilepsy is a condition we can manage. There's a lot of good news. We can manage the acute events, and also cure the disease. So if a person got an attack, what should you do? The first thing is to remove things which may injure this person from around the person. Unless the person has fallen into a dangerous situation, say maybe it's near a fire or onto a sharp object, the actions will not be aimed at moving the person, but removing the other things.
Removing the objects which can
injure that person, so that the person is relatively safe. Okay. With as much as possible, avoid putting things into the mouth of the person. Avoid restraining the person, especially the convulsive ones. The muscles contract with a lot of strength. They are very strong contractions. So as you try to restrain, you can break, you can fracture even a bone. Trying to put things into, like, say, a spoon or some clothing, which people often do to try to stop the person from biting the tongue. You may break a tooth. And if you broke this a tooth, the person may aspirate it. It may go into the airway and cause bigger problems. So try to avoid this as much as possible. And the majority of the attacks, the convulsive attacks, they last for 1 minute to about 3 minutes, and they tend to stop on their own. But where an attack lasts for longer than 5 minutes, this one requires urgent attention. You need help. You need to call for help quickly, and such a person should be transferred as quickly as possible to a clinic, to a hospital for treatment.
To receive treatment.
To receive
so
treatment.
If someone is having the seizure, we should aim to keep that person safe. Remove objects which are harmful around the person.
Yes.
Maybe like cups or broken, like knives or something.
You move chairs away,
remove
tables.
The chairs away.
Yes.
Kind of leave them to be on the ground until the seizure stops.
Yes, you should not be restraining them to remain, because you may injure them in the process. You can even break the neck or an arm.
And we shouldn't attempt to put things in the mouth, like spoons or handkerchiefs. So even the finger, someone may put the finger there and then it's bitten off.
Yes, especially in children, the teeth are very sharp. They may bite off your finger. Okay. And they may aspirate it, and you have bigger problems.
Okay, so in the adults, the Dr. Msewe, I think this is also the same pattern of management for someone who is experiencing the attack.
Yeah, I think that's rightly put. Adults actually are more, because they are more physically built, they are more dangerous, and most people, people feel more threatened by the situation. And in addition to fractures, they can get dislocations, and the jerky movements are so strong. So I just probably just to emphasize what Dr. Richard has said, Dr. Idro, that we remove the things and let the patient. The seizure mainly stops because as the person is seizing, there's reduced blood supply and oxygen in the brain. So we say that seizures abort themselves. So once that stops, it's an automatic system. Those are the good things which God made.
And they are short-lived. They don't last
It's
for long.
a circuit breaker. It just cuts off the seizure because there is no longer enough supply for the activity.
But we said when should we now worry and take someone to the hospital?
So yes, just I think Dr. Idras mentioned part of it. It's when we have a prolonged seizure. It used to be 30 minutes, but if this is continuous, going on for more than 5 minutes, we should start getting ourselves. More than 30 minutes is definitely a seizure which should be managed in the hospital. We should get other ways of managing. Or we can get any health worker nearby because they can do a bit of, most health workers are trained. They have an idea of what to do when there's a seizure. They can stop it with drugs which are very cheap. Diazepam, which is very cheap, is a very handy drug, which can be given in many ways, can be given via a vessel, but also patients should know that sometimes the drug can be given via the rectum. So sometimes if they see that happening, that can be. Then the other person who should go to hospital is if a patient has a seizure and is not waking up, irrespective of the person, the fact that he's no longer convulsing. But if it's taking very long, during a seizure, we know that the patient doesn't interact. So if you call him, the interaction is examined by either calling by voice or by stimulating pain. If you touch him, if he's not responding for that prolonged, not responding for more than 30 minutes, we should try to get to hospital. The other reason we should take to hospital is if he gets any injuries, burns, fractures, or wounds. Those we need to kind of deal with them in a hospital setting.
So we are almost coming to the end of the discussion. Remember, you can send in your questions, feedback, or comments on the social media platforms. Any question about epilepsy, if there's anything you're not understood, send in your questions on our social media platforms, and our doctors will ably respond to each one of them. So after the break, we shall come back and discuss more about how to prevent epilepsy. Yes, epilepsy is very preventable in as much as it's also treatable, and we shall also have discussions about the World Epilepsy Day. It's important for people to know what epilepsy is, and there is a day that commemorates the celebration of this disease. So don't go away. We shall be back after the break.
You are watching the DocTalk Show.
Welcome back. You're watching the DocTalk Show, and we're discussing a brain disorder called epilepsy with our neurologists in studio, Dr. Idro Richard and Dr. Musubiri Abdul. If a person is suffering from epilepsy, there's some things that may provoke these seizures. What exactly should they do to prevent themselves from getting the attacks of epilepsy?
Thanks, Darius, once again. As we stated that everyone who has a brain can get seizures, and under stressful conditions, even a normal brain can get seizures. So things like sleep deprivation can push someone to get seizures. So this becomes more important in patients who have epilepsy. Alcohol, if you take or you stop, can be a bit of a problem because alcoholism can be a predisposition to seizures. Patients have their unique features. They may find that maybe some special situations like flashlights make their seizures worse. We know that most of the time when you're watching programs, they kind of highlight this, that this may be dangerous for an epileptic, so you should avoid those situations. Normally, even if you have epilepsy, you can have other conditions that may require treatment. You may go to hospital with a fever, maybe malaria, maybe a flu. It's just good to inform the health worker that you are an epileptic so that when they're trying to prescribe drugs, they try to avoid drugs which may have interactions with epileptic drugs. In ladies, for example, family planning pills can have a lot of effect. Other drugs, we know that the main aim in management of epilepsy is maintain drug levels. So some drugs which we add on can reduce the drug levels to a sizable degree that it can cause the person to have seizures, while other drugs which we can take for other reasons can increase the drug levels to make the patient get side effects. So we request that actually this information is provided to a health worker.
Is there anything else you want to add, Dr. Ido? They're the same.
Exactly, the principles are exactly the same. What I will then take from here is then preventing epilepsy in general.
Okay.
We did at the beginning say that sometimes epilepsy may be caused by a genetic abnormality. So that one's passing through the gene. And to that, we may not have a lot of preventive mechanisms. However, there are many of the other causes. For example, those due to infections when the baby is still in the womb, those due to birth injuries during birth can be prevented by appropriate attendance of antenatal care, delivery by by health workers in health facilities which have safe delivery, mother having self-delivery.
Remember, epilepsy is a treatable condition. 7 out of 10 people who have epilepsy, if they receive the treatment and they take it very well, they can control the seizures and become disease-free. The doctors on the DocTalk show to you, epilepsy is treatable, epilepsy is not contagious, and most important, if you are a patient with epilepsy, remember to take your medicines, take as the doctor has prescribed, and the condition will be very well controlled.